Have you ever wondered what to do if you get a severe cut in an extreme condition? Picture this. You're out in the wilderness, far from any immediate medical aid, and you accidentally slice your hand on a sharp rock. This is not just a minor paper cut we're talking about. We're dealing with a deep, severe cut that's causing significant bleeding. In such extreme conditions, a severe cut can pose a significant threat to your life. It's not just the blood loss you have to worry about. There's also the risk of infection, which can lead to complications like sepsis, a life-threatening condition. Immediate action is critical. That's why we're here today, to provide you with a step-by-step guide on how to stop bleeding from a severe cut. This knowledge could be a lifesaver, literally. Now that we've established the importance of knowing how to stop bleeding, let's delve into the steps. The first and most critical step to take after a severe cut is to stop the bleeding. This is the golden rule of first aid, especially when facing a bleeding wound in extreme conditions. The body is a remarkable machine. In response to a cut, blood vessels naturally contract to limit blood flow. But sometimes, this isn't enough. That's when your immediate actions can be the difference between a minor incident and a life-threatening situation. The first thing you want to do is apply direct pressure to the wound. The human body has an incredible ability to heal itself, and by applying pressure, you're helping it along. This action encourages the blood to clot, effectively plugging the leak. Use a clean cloth or bandage if you have one at hand, but remember, in extreme conditions, improvisation may be necessary. A piece of clothing, a bandana, or any clean fabric can serve as a makeshift bandage. While you're doing this, try to keep the wound elevated. This is not always possible, especially depending on the location of the cut, but if you can, raise the injury above the level of the heart. It's a simple matter of gravity. By lifting the wound, you're making it harder for the blood to flow out. Now, here's a vital point to note. If there's an object impaled in the body, do not attempt to remove it. It might seem counterintuitive, but that object might be acting as a plug, preventing the victim from losing more blood. Leave it to the medical professionals to remove it safely. The process might be painful, and it might be scary, especially when you're in an extreme situation. But remember, the human body is resilient. With the right actions, you can significantly improve the chances of a positive outcome. So, whether you're an adventurer, a survival enthusiast, or someone who likes to be prepared, these steps are crucial. They are simple, they are essential, and they can save a life. Remember, stopping the bleeding is the most crucial initial step in dealing with a severe cut. So, be ready, be calm, and be prepared. Your actions could make all the difference. After you've managed to stop the bleeding, the next step is to prevent infection. Cleaning the wound is crucial. If possible, use clean water and soap to gently cleanse the area. Avoid scrubbing as it may cause further damage. After cleaning, apply an antibiotic ointment to ward off bacteria. This step is essential to keep the wound from becoming a breeding ground for infection. Next, cover the wound with a clean bandage. This will help to keep it free from dirt and bacteria while it heals. Changing the bandage daily, or when it gets dirty or wet, is important to maintain cleanliness. Stay alert for signs of infection. These can include redness, swelling, or an increase in pain around the wound. You may also notice a foul smell or pus. If these signs appear, seek medical help immediately. Knowing how to stop bleeding and prevent infection after a severe cut can potentially save a life in extreme conditions. To summarize, stopping bleeding from a severe cut involves 3 main steps. First, apply pressure to the wound to halt the bleeding. Next, clean the wound thoroughly to remove debris and minimize the risk of infection. Lastly, take measures to prevent infection, such as using antibacterial ointment and properly bandaging the wound. These steps are critical in extreme conditions where medical assistance might not be readily available. While we hope you'll never have to use this information, being prepared can make a world of difference in extreme situations. Stay safe out there.